How does managed care impact the dual eligible populations? Why does it matter? Welcome to CarePayments Pod. I'm Fadi Sahar, and I'm here with Mandy Sahar, the co-author of Value-Based Payment Blog and Dual Eligible Headquarters.
Hey everyone, I'm excited to be here. We just finished up the newsletter on this topic, so I'm really excited to dig in. As a reminder, the goal of the Care Payments Pod is to have a quick hitting but informative discussion about healthcare payment models and how they affect MCOs, providers, payers, and care recipients. As an advocacy first group, we want to make sure consumers have the best access to information and quality care as possible. All right, Fadi, so can you give us a brief overview of the importance of integrated health solutions for the duals population?
So, dual eligibles are a very important part of the future of healthcare, which is exactly why we've started dualeligiblehq.com. If you haven't subscribed to it, please do. It's free and it's available on our website. Dual eligibles are important in the future of healthcare because they are the ones who account for the vast majority of the cost of care. And as we go through today's pod, you'll find that we'll share some facts with you that'll tell you why the integration of taking care of the whole person, not just one aspect of their care needs, is very important. We need that concentrated, coordinated care to come together for individuals who have multiple needs. So, Mandy, you and I have been working on this for a while. So, where do you want to take us today?
Well, I want to dig into the group themselves. Obviously, they're a special group of people, so let's talk about them and who they are.
Well, today, dual eligibles account for 12.5 million individuals who are beneficiaries of both Medicare and Medicaid. So that's a very large group. And when you look at them within the respective Medicare and Medicaid populations, they represent a large portion of each of those programs. So when you think of the large federal Medicare program and the vast differences in the 50 Medicaid programs we have across the country, this group is being pixie dusted across the whole thing. They're all over the country, but they represent a very large portion of our care. Very interesting, close to 60% of the dual eligibles are women.
Hmm.
Not, you know, obviously some of it has to do with longevity, but we also find that 49% of the dual eligible population are people of color. And so
Wow.
we're looking at a particularly vulnerable population that has significant healthcare needs. But there's a couple of other surprises for the dual eligibles. You know that close to 40% are people under 65. So we normally think of Medicare as a program focused for individuals over 65. However, you think of the number of people with physical disabilities and other conditions that make them eligible for Medicare. And now, because of some of their financial position, they find themselves eligible for Medicaid as well. So think of the confluence of the factors of the individuals that we're serving here.
Yeah, it's an extremely dynamic group, right? Lots of different needs. It's a little bit of a moving target, and that population is growing and changing literally daily because of the baby boomer generation. So, what makes them so challenging in particular?
Well, let's start with the basics. Close to 50% of the individuals who are dual eligible are, are not able to perform at least two activities of daily living by themselves. They require assistance with that. That means they need help getting out of bed, getting into the shower, getting dressed, preparing a basic meal. And those are the factors that make these individuals require a high level of care if you cannot perform these activities of daily living. And but we're also finding that these are individuals who have number of factors that makes the care even more complicated. For example, 13% of the population that's dual eligible considers itself in poor health relative to only 4% of people on Medicare who consider themselves to be in poor health. They usually have 24% of them, of people with who are dual eligible, have at least one hospitalization a year relative to the Medicare population with only 15%. So one out of four duals goes to the hospital once a year versus one out of seven individuals over 65 goes to the hospital once a year. When you look at the ER visits, which are very expensive, 21%, one out of five, have at least one ER visit every year, compared to only 13%, close to one out of six, that have a ER visit every year. And now, when you go back to the number of ADLs, activities of daily living, we discussed 12% of the individuals who are duals receive home health supports versus only
Mm.
5% of the of the population on Medicare. So all these are elements that make their services, the healthcare costs, very expensive. And so we are looking at them at the population, 34% of the Medicare population and 30% of the Medicaid population. Remember, they only represent a smaller percentage of both populations there. So we have a big challenge ahead of us from a cost of care perspective.
Yeah, I mean, thinking about some of those numbers you said, looking at inpatient and ER visits, those things cost a lot of money. If one in five or one in four is in the hospital that often, we're up against a fight here as we start to manage this care.
Well, but also think about the quality of life that these individuals have. Now, as advocates, we care about the quality of life. So if an individual is having to go to the hospital, one out of five ends up in the ER every year. One out of four ends up in the hospital once a year. You're talking about folks whose quality of life could be significantly improved if we give them the right care.
For sure. So, as we look towards managed care, why is this population so important to managed care?
So as more and more states are moving their healthcare needs into contracted managed care organizations, the vast majority of individuals are now engaged in the delivery of monitoring services through a managed care organization. So, for example, 24% of the Medicare Advantage and Medicaid managed care plans are people who are individuals who are enrolled in a managed care organization. One out of five. So think of the statistics we just went through, and now we have one out of four is in a managed care environment. So all this compounds why managed care organizations are looking at this population as a place where they have to really understand and deliver a higher quality of care.
Yeah,
We're also
absolutely.
seeing that 8%, only 8% of the healthcare services today are truly integrated. That means we've managed to bring together the physical health, people going to the hospital and their doctor, the behavioral health supports that a person who's going through these kind of challenges may need on a behavioral health basis, mental health basis, and then we talked about the needs for ADLs, long-term supports. So when you combine all these factors together, yet you find that only 8% of this population that has these compound needs is actually being managed through a managed care environment. You know that in the long run, we're going to see that trajectory continue to rise.
Yeah, I mean, it's going to have to, because a common theme of what you're saying is a fragmentation of care, right? They're getting care from different places. That causes overlap, it causes delays. So where do we see that come into play, kind of as we look at those numbers?
Well, think about how we can improve this. Or when we think of a person who is 65 years old with a disability on Medicare and Medicaid. Today, they may have Medicare fee for service from one company. They would have their Medicaid through the state, physical health through the state, and then they would have their long-term supports through possibly another MCO. So when you start to try to arrange and prioritize and optimize the care, you're looking at coordination that's very difficult across multiple silos. So we see that the more integration we can bring together, the more likely we are to get better coordination of care, but also to have better outcomes and reduce costs. That's where
Yeah,
value-based payments kicks in, right?
right, and a better quality of life, right?
Yeah,
So all of
thanks
that
for
starts.
bringing that back.
Of course, there you go. Um,
And
so we
so
talked
before
about.
we do that, there's a couple of models that are starting to gain traction. There
Okay.
is a Medicare, Medicaid plans that are being instituted across a number of states, and there's the dual eligible special needs plans. And some of them are highly integrated, some of them are fully integrated. So maybe in one of our future pods, we'll have to take that as its own topic because I know we're running today.
Yeah, well, and DSNPs have been a topic on our VBP blog before, that we've written pretty extensively about. So lots of good information there. So as we look at social determinants of health, how are populations' outcomes affected as we look at that specifically?
Well, the fact that an individual is on Medicaid means that they essentially have relatively low income and very few assets. So 87% of the dual eligibles have an annual income of $20,000 or less.
Wow.
87%. So think of the cascading effect of that on the rest of the individual's life, where they live, their access to transportation, their access to good food, access to employment if they wish to have it, access to socialization, and think of the how that could result in significant isolation and so on.
Absolutely. I mean, that is a big number. So as we look at the end here, we want to think about our advocates' perspective. Obviously, that's an important piece for us as a group. So how would you wrap this up from an advocate's perspective?
Well, as an advocate, I watched many individuals have to struggle through a fragmented system. So we know that the current system has many shortcomings, and there are slivers of hope that we can make it more streamlined, we can make it more manageable for the individuals, and we know that as we look at both physical health, long-term care, as well as social determinants, access to being supported in the community, we can do a better job. And so we're hoping that the work we do with DEHQ, as well as some of the writing we do, some of these podcasts we're putting out there, will help raise this profile. We think there's a bright future, though.
Yeah, of course. So, as you just said, we're excited about our brand new effort, DEHQ. And as things pick up around this population and changes and new models are being made, we're going to keep that information up to date as a resource for you, for payers, consumers, providers, as that moves forward. Don't forget to check out our VBP blog as well. We've been writing that for about 6 years. So, that has all information really focused on value based payments. So, Fatty, thank you.
Absolutely. And as always, onward.